Hi everyone. In today's clip, I will talk a little bit about lichen planus. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So lichen planus is a chronic inflammatory disease that affects the skin, mouth, so it's oral mucosa, nails, and sometimes the genitals. This ailment is not contagious, and it is thought to be an autoimmune condition, meaning your immune system attacks your own tissues. Common symptoms include purple skin, flat-topped and itchy bumps, often on the wrists, ankles, or lower back. And in the case of mouth or oral lichen planus, we will see white lacy patches inside the cheeks or sometimes painful sores or ulcers. On the nails, being less common, we will see thinning or ridges or nail loss, and in genitals, we will see pain, itching, or white patches. So the exact cause of this is basically unknown to the conventional medicine, but they believe it could be linked to immune system problems. Certain medications can also cause this, infections like hepatitis C in some cases, and stress, which also can worsen it. Now, conventional medicine does not have a permanent cure, but they manage this issue with topical corticosteroids, whether it is cream or gel, antihistamines for itching, immune modulating drugs in severe cases, and oral hygiene for mouth involvement. Some forms, especially oral lichen planus, needs regular monitoring, as there's a small risk that there's going to be other complications. So lichen planus can appear under several related names depending on where it sort of happens in the body and how it looks. The common names include oral lichen planus, which affects the mouth, cutaneous lichen planus, which is the classic skin form. Then we have lichen planopilaris, which is a form affecting the scalp and hair follicles, sometimes causing hair loss. We have nail lichen planus, which involves fingernails and toenails. There's genital lichen planus, affecting vulvar and penile tissue. And then there is hypertrophic lichen planus, which is thickened, very itchy plaques, a more painful form of it that can create sores or ulcers, especially in the mouth or genitals. And then there is pigmentosis lichen planus, which is a darker pigmentation, heavy variant seen more often in some skin tones. Historically or casually, some people even may call it shortened to LP. So the word lichen comes from its moss-like sort of appearance on the skin, though it has nothing to do with the plant-like organisms called lichens growing on rocks or trees. Orthomolecular medicine and natural support approaches for lichen planus generally focus on calming inflammation, supporting the immune balance, reducing triggers, and helping tissue healing. So common suggestions are going to include vitamin A or beta-carotene, which is traditionally used because vitamin A supports skin and mucosal tissue repair. But excess vitamin A can be toxic, so high dose use sort of needs caution. Vitamin D3 and K2, which is often suggested for immune regulation support, especially if the levels are low. Then we have vitamin C plus bioflavonoids, which is used as an antioxidant and for connective tissue support. Think of them as a part of the body, sort of rust control crew. Then there's B-complex vitamins, especially when stress, nerve irritation, or mouth involvement is present. Then zinc sometimes is suggested for skin healing and immune modulation. Omega-3 fatty acids from fish oil or flax, commonly used to help calm inflammatory processes. I rather actually krill oil. Then there's curcumin, which is turmeric extract, basically frequently suggested for inflammatory conditions. And there's aloe vera, particularly for oral forms of this. And some people use aloe gel or rinses for soothing, as well as probiotic for gut support. Super important. Because there's an immune imbalance, and gut ecology are very much connected. So potential trigger reduction often includes avoiding alcohol, tobacco, reducing high processed foods, identifying food sensitivities, and managing stress and sleep. For oral lichen planus specifically, people sometimes need to avoid very spicy or acidic foods, cinnamon-containing products, strong alcohol mouthwashes, but then I disagree with commercial mouthwashes anyhow, as they do more damage than they do good. Old approaches to lichen planus have existed in many healing systems long before the condition even had a modern medical name. So most aimed to cool the heat and calm irritation, purify the blood, soothe the liver, or heal damaged tissue. Some of the more widely known remedies and ideas are like aloe vera, applied directly to the skin lesions or used gently in the mouth. This has been valued for cooling and tissue repair. Or licorice root, used in traditional Chinese medicine and folk herbalism, and sometimes applied to as rinses or teas to calm inflammation. Then there is marshmallow root. This is rich in soothing mucilage, and it is used for irritated mucous membranes. There is chamomile, which is used as compresses, rinses, or teas to calm itching and irritation. Turmeric, used in Ayurveda for inflammatory skin conditions, often is combined and drank with warm water or honey. Then we have coconut oil, used specially for oral irritation and dry lesions, and as a skin remedy for dryness and inflammation. Coconut oil, oil pulling in the morning, for example, is exceptionally helpful. Then there's calendula salves for skin healing. Older Europeans or the Persian and indigenous herbal systems often talked about that the chronic skin eruptions reflected impurities or internal imbalance. Herbs that are historically used include burdock root, dandelion, yellow dock, or nettle, commonly taken as teas or decoctions. In systems like Ayurveda and Persian traditional medicine, inflammatory mouth and skin conditions were often viewed as excess heat. People were advised to favor and eat things like cucumber, pomegranate, barley water, sour cherry, lettuce, and rosewater preparations, and reduce excess spicy and very acidic foods, fried foods, and alcohol. Oral remedies for oral lichen planus are saltwater rinses, honey, sage tea rinses, baking soda rinses, often used to soothe sort of soreness and keep the mouth clean. Many older traditions also link chronic skin eruptions with emotional strain, grief, anger, or nervous exhaustion. Remedies sometimes included meditation, nature walks, mineral baths, moderate sunlight, and restorative sleep rituals. Many ancient systems treated inflammatory conditions as an overheated engine, something that needed cooling and softening and restoration rather than attack. So there are indeed also books, reports, patents, animal studies, and alternative health articles, discussing the use of DMSO or dimethyl sulfoxide. I personally have not seen DMSO used internally for this particular condition, but usually taking half to 1 teaspoon of MSM supplement, which you can find online in most health food stores, every 12 hours orally, and then using DMSO topically works best. DMSO can be used topically sort of in its pure state. But continued application in the same area is going to thicken the skin and it's going to cause peeling. So make sure the skin is clean if you're using this and toxin free before applying the MSO. Either take a shower or clean the area with natural soap and water. And if you feel you apply too much DMSO, then wash the area with pure water, not tap water, unless it is filtered, which will remove any DMSO that is still left on the skin. Do not wear clothing over a freshly treated area. Remember, DMSO is a powerful solvent, and it will take the dye right out of the clothing and deposit it into the skin. Wait 20 minutes after applying DMSO to get dressed, and be sure to wipe off any leftover residue first before doing so. Don't wear synthetic fragrances, for example, perfumes, colognes, body lotions, aftershaves, hairsprays, or fragrances left on clothing by laundry detergent or dryer sheets. When you're using DMSO, don't use any of this. Synthetic fragrances are absorbed into the body through the skin, and you also breathe them in. So do not consume any alcohol while you're using DMSO, and if you smoke, limit your use of DMSO or quit smoking. Today's cigarettes contain over 4,000 chemicals, and negative interactions with DMSO are absolutely possible. I have a DMSO caution clip actually that I posted a while back that I urge you to watch to better understand the do's and the don'ts. So for skin conditions, use 80% dilution. This percentage is effective for skin applications blended with distilled water or preservative-free aloe vera gel juice. And it's also an optimal percentage to use if mixing it with other nutrients like vitamins, minerals, or botanical extracts. And a 30% dilution can be used for face, eyes, ears, and ingestion. The best mouthwash for such condition is usually just salt water. 1 cup of warm water mixed with half a teaspoon of sea salt, a quarter teaspoon of baking soda, and a couple of drops of peppermint and clove oil, and swish it around for 30 to 60 seconds, up to 3 times a day. So ancient systems basically often emphasize gentle consistency over aggressive intervention, less flamethrower, and more gardener sort of tending soil over seasons. Hope this has been helpful. My clips are available on TikTok and YouTube. Like, share, and follow for more. Be the light.